Aloha and good afternoon. Welcome to the 3 o'clock Higher Education Committee hearing, and we have also a 3:15 agenda jointly with the Committee on Health. We are in room 3229. My committee members, my vice chair is Senator Michelle Kidani. Also on Zoom, we have Senator Kurt Favela, always present. Thank you. I'm not sure if any of the other members are on Zoom, but I'm sure they'll be joining us. This meeting, including the audio and video of remote participants, is being streamed live on YouTube. You will find links to viewing options for all Senate meetings on the live and on-demand video page of the legislature's website. In the unlikely event that we have to abruptly end this hearing due to major technical difficulties, the committee will reconvene to discuss any outstanding business on Thursday, March 25th at 3 p.m., and a public notice will be posted on the legislature's website. For people participating remotely, all testifier audio will be muted and video disabled until shortly before it is your turn to testify. Testifiers will be limited to 2 minutes each. At the end of the 2 minutes, the audio will be automatically muted. I'll be reading a list of people who submitted written testimony for each measure. We apologize if the closed caption does not accurately transcribe the names, and if you're interested in reviewing the written testimony, please go to the legislature's website. You will find a link on the status page of the measure. If there are temporary technical glitches during your turn to testify, we may have to move on to the next person. Due to time constraints, we appreciate your understanding and remind you that the committee has your written testimony. And I believe we do have a hard stop at 4:30. Is that correct? It's hard stop. Okay. So, moving on with our first agenda item is House Bill 313, House Draft 2, relating to physician work assessment. Repeals the requirement that no less than 50% of the physician workforce assessment fees deposited into the John A. Burns School of Medicine Special Fund be used for purposes identified by the Hawaii Medical Education Council. Repeals the monetary cap of expenditures from the John A. Burns School of Medicine Special Fund, authorizes the John A. Burns School of Medicine Special Fund to provide loan repayment to certain physicians and scholarships to qualifying medical students. First testifier with comments, Alani Kuyoke, not here. Ann Estacio from DLIR in support. Kelly Withy, University of Hawaii in support. Kelly?
Good afternoon. I'm representing UH, and I'm going to stand on our strong testimony and support.
Thank you very much, Kelly. We do have 1, 2, 3, 4, 5 others written and in support. Is there anyone else online that's wishing to testify on this matter? If not, members, any questions of Kelly representing the University of Hawaii on this measure? Hearing no questions. Kelly, good job. Thank you very much. Going to move to our next measure. I want to welcome other committee members, Senator Gil Keith Agaran and Senator Glenn Mackay. Okay, moving on to House Bill 389, House Draft 1. Requires accredited and non-accredited for-profit post-secondary educational institutions that are authorized in the state to disclose in print and electronic media and signage that they are for-profit business. Stephen Levins from DCCA in support. Stephen, I don't think you're here. Bobby Lum-Mew, DCCA in support. Bobby?
Good afternoon, Chair. Yes, Bobby Lum-Mew with the Hawaii Post-Secondary Education Authorization Program, or HPEAC. We stand on our testimony and support, and I'm available if there are any questions.
Okay.
Thank you.
Thank you very much. We have Jonathan Padua opposed. Myung Oh from the Chamber of Commerce with comments. Myung?
Hello, Chair, Vice Chair, members of the committee. Myung Oh on behalf of the Chamber of Commerce. We stand on our written testimony offering comments, and just want to highlight that we do agree that arming consumers with information is essential. As far as this bill, we feel that this is a little bit excessive to require that the four, to our knowledge, education providers who are not nonprofit would have to recatalog, rebrand with all new materials and signage. There may be alternative ways that we are not looking, but we feel that at this time, this may possibly go a little too far. Thank you.
Okay, thank you very much. Ashton Cujo, did I say that correct? Cujo, from Hawai'i Medical College, please.
Yes. Well, I just wanted to share my appreciation for all of you at least hearing me out. We do stand opposed to the bill. However, I stand by my written testimony, and if you have any questions, I'd be available to answer those. Thank you much.
Thank you very much, Ashton. Next is Annie Makapagal from University of Phoenix. Also,
Aloha.
please. Aloha.
Aloha, Chair, Vice Chair. Annie Makapagal on behalf of University of Phoenix. Thank you for the opportunity to testify. I'll basically stand on the written testimony stating our concerns about how the bill singles out the tax status of an institution. But aside from that, I'd also like to present to you that there are good and bad actors in any industry. As far as the University of Phoenix is concerned, actually here in Hawaii, we certainly do strive to be a good actor in the community, and with that, we are open to discussing other methods to weed out any bad actors, and ask respectfully that you hold this bill in committee. Mahalo for your time.
Thank you very much. Alexis Dronon from Quantum University.
Yeah, my name's Alexi Drone. I'm the Vice President at Quantum University. I first wanted to thank this honored committee for the opportunity to give this testimony in opposition of HB 389. We're a for-profit, unaccredited degree-granting institution here in Hawaii since 2007. And we're opposed to HB 389 because it goes against the recommendation of the Office of the Auditor of the State of Hawaii, who established in 2014 that Chapter 446E does provide sufficient consumer protection. In addition, unaccredited institutions have not received any complaints during the last 10 years. In addition, the report that's referenced by the committee to support HB 389 really focuses on the U.S. Debt problem. And by definition, unaccredited degree-granting institution like us, we cannot accept student loans. So we're neither mentioned in the report nor part of this problem, but yet we're included in this bill. And we felt as well that this bill had many negative assumptions regarding our industry that's simply not true in our case. We're not engaged in any improprieties. We're not a large corporation on the mainland. We're not listed on the stock exchange. We're a small family-owned business located on Bishop Street in downtown Honolulu in the Dillingham Transportation Building. We create good jobs for the state. We're accountable to our staff, our students, our graduates, and our students do not qualify for student loans or federal aid. So we're proof that many of the assumptions in that bill are simply not true. So in conclusion, what I wanted to say was that the auditor's report concluded that the legislation was not required. There's no complaint currently existing against unaccredited institution, and we're not part of the student loan problem. So we just ask that we will not be included in HB 389 and that this bill is not during the current legislative, and that the conversation is continued in 2016. Thank you, and I'll be happy to answer questions if needed. Mahalo.
Thank you, Alexis. Anyone else wishing to testify on this measure? Hearing none. Members, any questions for any of our testifiers?
No.
I do have a question for Bobby. So, having heard some of the testimony and having read some of the testimony, do you feel that there is enough safeguards, or you think that this measure is, in some form, might still be needed?
Well, like my testimony said, a lot of times we don't hear about any problems until it's too late, until the school is pretty much closing. I can only speak for the accredited degree granting institutions that my office authorizes. As far as the unaccredited institutions, I know Steve Levins isn't on, but I'm sure there have been, I can't name the complaints or number them, but to say that there were no complaints against any of the unaccredited institutions in the past 10 years, I don't think that's so. I'm sure there were some. It's just that he's not on, so we don't know the numbers.
Okay.
So
So the fact that they would just put onto their materials for profit, would that in itself be enough? I mean, most students know or understand for-profit or non-profit?
I think so, but a lot of times they need more explanation. I guess for us, when we talk about the unaccredited, when you look at their websites, they look very official, and students, prospective students do get confused, and they actually end up calling my office. And I usually have to refer them to the Office of Consumer Protection because they're the office that takes in complaints. But they get confused about that because it looks so official when they look on the website. So I think any kind of extra precaution would probably help.
Okay, thank you. Members, any other questions of testifiers? Okay, hearing none, thank you very much. We will move on to the next item. Decision-making will be made at the end of our both hearing agendas, by the way. Thank you. The next item is House Bill 1291, House Draft 1, relating to scholarships. This allows allows applicants for the University of Hawaii and students enrolled at community college campus who graduated from a public high school in the state with a cumulative grade point average of 3.0 and qualified and received special education services for 2 or more years during enrollment in grades kindergarten through 12 to be eligible for Hawaii State Scholars Program and the Hawaii Community College Promise Program, respectively. First up is Hei Okimoto, University of Hawaii. Support. Hey.
Good afternoon, Chair Kim, Vice Chair Kidani, and members of the committee. I am Hei Okimoto, Associate Vice President for the University of Hawaii System. I stand on my written testimony in support of the intent of the measure with the recommended revision of removing the Hawaii Promise Program, which is a need-based scholarship from this bill. And I also want to point out that the state scholarship program is awarded to students when funds are available, but funds are currently not appropriated for the scholarship. Thank you, and I am available for questions.
Thank you very much. Susan Rocco, Special Education Advisory Council, in support. Susan, are you here?
No.
I think so, okay. Sean Whitwer, in support. Sean?
Good afternoon, Chair Kim, Vice Chair Kidani, and members of the Higher Education Committee. My name is Sean Whitwer, and I'm a special education math teacher, and I've taught at Frankton High School for 22 years. I support HB 1291 because I believe there's a massive achievement gap between students with and without disabilities in the DOE. If you look at the on-time graduation rate of students with disabilities and the college-going rate, the college-going rate is only 31% for students with disabilities versus 57% for students without disabilities. I believe that HB 1291 will help to close the achievement gap by providing hope and equitable opportunities for scholarships at UH and the community colleges. And I ask that you support it. Thank you.
Okay. Thank you very much. Lena Ala Kealoha, in support. Nicole Dolobala, in support. Nicole?
Hi, Chairman. Sorry if my Wi-Fi lagged a little bit. My name is Nicole Delarbala, a senior at Frankton High School in elementary. I felt like a failure for years because of my learning disabilities. At the age of 10, I was diagnosed with dyslexia, dysgraphia, and anxiety disorder. I have been in a special education program since I was 12. Although I once struggled with 1st percentile. I will now be graduating with summa cum laude at Barrington High School. Although I'm graduating with honors, I'll be the only one in my entire class in special education to reach the school. In fact, only 51% of students in special education at my school will be graduating on time. There is a massive achievement gap between students in regular education and special education at public schools. Not only will HB 1291 provide hope and financial assistance, it will also provide equal opportunity for special education students to access scholarships. I worked with my teacher and Representative Ono to create HB 1291. It's important to me, and I hope it is to you too. Thank you.
Thank you, Nicole. Congratulations on your successes. Also note my son was also diagnosed with as dyslexia and ADD when he was young as well, and was able to overcome that. So thank you for your testimony. Janet Kim, also in support. I don't believe Janet is here. Members, any questions for any of the testifiers today? I just have one question. Maybe Sean, you can answer this. I noticed it's from kindergarten to 12 and only 2 years. Why kindergarten to 12 and why just 2 years?
That was some of the recommendations that other people had and suggested. Normally when someone is in special education, they are in special education for at least 3 years before they have a reevaluation. And so by making it for 2 years, it basically opens up the opportunity for anybody that's in special education. Most students that I believe are in special education, if they're going to be rescinded, are rescinded usually we see in high school. So this opens up the opportunity for more students. And so it was a recommendation from one of the people that we went into contact with from UH.
Okay, thank you. Members, any other questions on this measure? If not, thank you very much for those that testified. We are moving on to HB 1067, House Draft 1, relating to procurement. Removes the sunset provision in Act 42, Session Laws of Hawaii 2018. Jan Govea, University of Hawaii.
Good afternoon, Chair Kim, Vice Chair Kidani, and members of the committee. Jan Govea here on behalf of the University of Hawaii. We stand on our written testimony in support of this measure. I'm available for any questions, so thank you.
Thank you. We have Nathaniel Kinney, comments. Bonnie Kahakui, the State Procurement Office, in support. Bonnie's not here. Ryan Sakuda, also in support. No one else. Members, any questions for University of Hawaii, Jan Govea? No. I have a couple of questions. Jan, so the difference between design build and P3, the fact that the risk is greater for P3s, correct?
I think design build and P3s are in different categories. They're not really in the same kind of category of projects. I would say design build is maybe more a method of delivering construction or vertical buildings or any form of a project. It's the method of delivery. P3s are maybe more describe relationships, a business relationship between an owner or an owner of land with a business entity on the other end, usually typically a developer that brings financing as well as construction and operation oftentimes to a project. So it's a little bit of a different.
I got it. So do you handle all the procurement, including those for P3 and design build?
No, so I primarily handle your typical CIP projects, and any P3 projects have been transferred under Vice President Young, the Office of Strategic Partnerships and Development.
Why is that? Why is that?
Because I think for P3s, it really does involve more complicated elements around financing and understanding business terms and where risks are, knowing how to negotiate with developers on multiple matters like construction, but also long-term financing, as well as deliverables throughout the life of a project, which can go, a P3 relationship can go for decades, 30 years oftentimes. And so it's really, the P3 element manages that entire 30-year process.
But shouldn't P3 projects still be under your responsibility as the Vice President for Administration, managing all of these programs and procurement, real property, risk management, capital improvements? Shouldn't that be, because all of them are related? I mean, you cannot separate just because it's a P3 that it doesn't fall under your jurisdiction and under the procurement.
Yeah, that's, we have discussed that internally, and it was at one point in time under my jurisdiction or my area. But as it started to take on a lot more of a presence in our strategic priority, and because of the extent of financing knowledge that is really required to make sure that the deal is done right, we made a kind of this decision to transfer that full area to our CFO, Vice President Young, who I see is on this call.
Okay, thank you. Members, any questions from University of Hawaii? Hearing none, thank you very much. Our next item we're on is our last one for this agenda. Thank you, Health Committee, for bearing with us until we get done. House Bill 1069, House Draft 1, relating to the Hawaii Cancer Center Research Special Fund, amends the reporting requirement at the Hawaii Cancer Research Special Fund from semi-annually to annually. And Randall Holcomb is in support. Anyone here to testify on this measure? Seeing and hearing none, no one to ask questions, so that will end this agenda. And then we will move on into the next joint. Let's come back later and vote on all the measures. So if we, Senator Ke'okolole, if you would like to open up, since you are the lead on this joint.
Okay, yeah, we're ready. Okay, so why don't we convene our 3:15 joint agenda between the committees on health and higher education. Okay, since we're already going, why don't we'll just move into HB 1296 HD1 relating to state funds. This repeals the Hawaii Tobacco Prevention and Control Trust Fund and transfers unencumbered balances to the general fund. It also specifies that the Hawaii Tobacco Settlement Fund, special fund monies shall only be deposited into the University Revenue Undertakings Fund until July 1st, 2033, and appropriates general funds correspondingly. So first we have the Attorney General's office, Mr. Goto.
Good afternoon, Chairs Ke'okolole and Kim and members of the committees. I'm Blair Goto, Deputy Attorney General. The Department of the Attorney General wishes to comment on a potential constitutional problem with Section 5 of the bill. Section 5 requires unencumbered balances remaining in the Tobacco Prevention and Control Trust Fund as of July 1st, 2021, to lapse to the credit of the general fund. Because of the contract between the Department of Health and the Hawaii Community Foundation to invest trust fund monies and to implement a community grant program, we recommend a change to the lapse date as recommended in our written testimony to help avoid an Article 1, Section 10 United States constitutional challenge to the bill. I'm available for questions. Thank you.
Thank you very much. Next, we have the Department of Health in opposition.
Thank you, Chairs Ke'okolole and Mikado Kim and Lola Urban with the Hawaii State Department of Health representing Director Libby Char. The department respectfully opposes HB 1296 HD1 that would dismantle the existing comprehensive tobacco prevention and quit smoking services for youth and adults by repealing the trust fund and the advisory board. The money in the trust fund is from tobacco company profits and used only for tobacco prevention. The trust fund receives 12.5% of the annual payments through the Tobacco Master Settlement Agreement. Tobacco use has been linked to diseases in nearly every organ, is the leading preventable cause of death, and nicotine is one of the most addictive substances, the reason why Hawaii joined the multi-state lawsuit. Hawaii has found the best way to use the profits of the tobacco companies through helping adults, pregnant women, and youth quit smoking and vaping, preventing youth from using tobacco, and educating and involving communities, especially youth, in tobacco prevention efforts. The DOH contracts the Hawaii Community Foundation to manage and invest the funds and staffs the advisory board. Over 20 years, Hawaii has reduced adult smoking rates by 38% and youth by 81%, and saved the state over $1 billion in direct healthcare costs. However, significant health disparities exist, and the high youth e-cigarette use has eroded progress. The department does not have the infrastructure to reconstruct this program that is responding to the quickly evolving tobacco products landscape. We respectfully ask that the committees allow the original intent of Act 304 for the trust fund and advisory board to continue. Thank you for the opportunity to provide comments and to oppose the bill. Thank you.
Thank you very much. University of Hawaii offering comments.
Good afternoon, chairs. Calvert Dion, Vice President for Budget and Finance for University of Hawaii. We can stand on our testimony that has been submitted, offering comments. The points of the Department of Health aside, the University of Hawaii is satisfied that the bill adequately addresses those issues that would impact the University of Hawaii, the debt service and bonds outstanding of the University of Hawaii for JABSA, and those comments are provided in the testimony. Thank you very much, Mr. Chair.
Thank you very much. Next we have Adventist Health Castle in opposition. Okay, moving on to Aloha Care in opposition.
I'm so sorry. I'm so sorry. This is Allie. I'm so sorry I wasn't. May I still speak, Senator Chair, from Adventist Health Castle?
Go ahead.
Okay, thank you so much. So thank you so much for allowing Adventist Health Castle to respectfully oppose HB 1296 HD1, which repeals the Hawaii Tobacco Prevention and Control Trust Fund. Our organization is committed to our community's well-being and blessed to be working alongside with you in serving our community. An example of Castle's commitment is our Live Well Tobacco Free program, which is a comprehensive program that has been funded by Hawaii Community Foundation for the past 12 years. This free program has greatly impacted the well-being and quality of life for participants and their ohana, especially in East and North Oahu and throughout our state, and continues to successfully help tobacco users from priority populations quit tobacco use, including those with serious behavioral health diagnoses, pregnant mothers, the underinsured or uninsured, Native Hawaiians, and those dealing with substance abuse and homelessness. It reaches strong proportions of highly addicted tobacco users while providing participants with grant-funded nicotine replacement medications, which is a critical component which assists individuals to have the confidence to become tobacco-free and remain tobacco-free. Even through the challenges of providing excellent care through the current pandemic, our program has actually been able to broaden access to the entire state through our free remote virtual services for individual counseling, group classes, and support. And considering the research that shows young adult and teen e-cigarette users had a 5 to 7 times greater chance of being diagnosed with COVID-19 when compared to those that did not use e-cigarettes, our program continues to educate our community and provide hope with a proven strategy for tobacco cessation to increase immunity and reduce risks in the fight against COVID-19. Tobacco prevention and cessation. Thank you for letting us have this opportunity.
Thank you very much. Aloha Care in opposition.
Good afternoon, chairs, members of the committee. Trish LaChica on behalf of Aloha Care, testifying in opposition to this measure. Aloha Care is concerned with the dismantling of the Tobacco Prevention and Control Trust Fund, which is one of the rare special funds that have really proven to be effective in keeping our communities healthy and safe. We, as the only dedicated health plan that's dedicated to serving our Medicaid population. This impacts our members greatly. In 2020, Aloha Care, it cost Aloha Care about $14 million to treat tobacco use with most recently, our youngest recording case of vaping-related illness is at age 10. And we believe that preserving the fund would not just help reduce healthcare costs for the state, but also preserve and save lives of hundreds and thousands here in Hawaii. Mahalo for the opportunity to testify.
Thank you. American Cancer Society, Cancer Action Network, in opposition.
Thank you, Chair Keokuhole, Mercado Kim, and Vice Chair Baker, Kidani, and Joint Committee members. Cynthia L. testifying on behalf of American Cancer Society, Cancer Action Network, and we respectfully stand in strong opposition to this bill. We thank the legislature for recognizing the importance of tobacco control and prevention programs by allocating $5.4 million for 2 years, but that may lead to the decline in progress that has been made over the last 20 years. In disrupting the current programs in place and having to form a new process of implementing systems to bring vendors on board to do the tobacco prevention programs would take time. Protecting respiratory health is vital during the pandemic, and we must have resources available, especially now, and especially with the rise of e-cigarette use for those who may be trying to quit. 24% of cancer deaths in Hawaii each year is a result of smoking. ACS CAN has not been a recipient of money from the trust fund, and we respectfully ask the committee to consider using money collected from the tobacco company settlement for its intended purpose to fund tobacco prevention, control, and cessation programs in Hawaii. Only a small portion, 12.5% of the settlement funds, are currently allocated to tobacco prevention control programs to reduce cigarette smoking and tobacco use among youth and adults. Thank you for the opportunity to testify in opposition.
Thank you very much. American Heart Association, in opposition.
Hello, Chair Keokuhole, and Mercado Kim, and Vice Chairs and Committee members Don Weissman with American Heart Association. We are in strong opposition to this bill. You've got my written testimony. I won't go through all of that, but I will just highlight a couple points. And this is a legacy fund, a special fund. It's not a traditional special fund. It's a legacy fund that was created to offset the tobacco industry's damages to the state and to help cover the future costs of the health damages that their products continue to cause in our state. I was around back in 1998 and sat in meetings with then Attorney General Bronster and represented the community, and our concerns were that would this money be used appropriately by the state? Other states, our concerns were well founded. North Carolina ended up using some of their money to build new roads to tobacco for tobacco farmers. North Dakota built a new morgue, sort of appropriate, I guess. But Hawaii has been recognized as one of those states that has really done well with this special fund money. And I've never smoked a cigarette in my life, yet every year I'm part of one of those families in Hawaii who every year pays over $800 for tobacco-related expenditures that are covered by our taxes. And this money is actually set aside to help control those costs and hopefully reduce them. This is a legacy fund, and I hope your legacy won't be to be the legislators who ended the tobacco prevention and control funding that the state invests, because this is the only source of funding that the state does put into tobacco prevention and control. So if you have any questions, I'll be here. Thank you for your time.
Thank you very much. American Lung Association in Hawaii, in opposition.
Aloha Chairs, Vice Chairs, and Committee members. I'm Pedro Haro, Executive Director of the American Lung Association in Hawaii, and I'll be augmenting my written testimony in strong opposition. One of the things that I wanted to highlight is that the trust fund created these tobacco programs to the specifications of the best practices for comprehensive tobacco control programs by the Centers for Disease Control and Prevention and the National North American Quitline Consortium, which outlines not only how they should be spent, but also how they should be evaluated and the outcomes that can be expected. This bill is particularly troubling considering that our local elected officials have regarded CDC guidelines for COVID-19 to be essential, and you have done a great job in following those guidelines. but yet we're ready to ignore those CDC guidelines on this particular issue. One place that we don't follow CDC guidelines is that no tax dollars have ever been earmarked for tobacco control, and the state doesn't even reach 70% of the recommended spending levels the CDC recommends. With the appropriation that this bill puts in, we will barely be reaching 50% of the CDC levels. That would be a failing grade. It's particularly troubling considering that, like COVID-19, tobacco affects Native Hawaiians and other Pacific Islanders harder than other populations. As a state, we take taxes from these tobacco users to fund other states' initiatives, but 0% of those taxes go back to helping quit smoking. And now this bill proposes to provide even less services for the 1,400 people that die every year. If the issue is a lack of understanding the return on investments on the dollars, then perhaps we should consider a study or simply require that DOH submit the reports to the legislature each year, which it already does for the Trust Fund Advisory Board, which has representatives from the House and Senate. ALA has seen that other states that have eliminated their freestanding tobacco prevention and control trust funds have seen the dollars reduce, have seen the smoking rates increase, more deaths, and more children addicted. This is a heavy burden to leave on our children. We ask you to please defer this bill. Thank you very much.
Thank you. Next, we have Bay Clinic in opposition.
Good afternoon. I wanted to thank the members of the committee for allowing me to testify. My name is Judith Beaver. I'm a tobacco treatment specialist and I work for Bay Clinic Health Centers on the Big Island of Hawaii. We respectfully strongly oppose the bill HB 1296. Bay Clinic on the Big Island, we have clinics in Hilo, Ke'au, Pahoa, Na'alehu. Thanks to the funds that we received from our tobacco program grant, since 2012, we've been able to provide tobacco treatment services for 1,332 tobacco users. This number only reflects the first individual registrations. After registrations, we continue seeing the client number of times during their tobacco cessation journey. Services provided include one-on-one counseling and educational services, as well as group services and sessions, along with grant-funded nicotine replacement therapies. Since COVID-19, we've also opened up both group and one-on-one sessions to our telehealth program. This has aided with the social distancing concerns of our patients. This past year, COVID-19 has caused a significant increase in anxiety and stress to many current smokers as well as ex-smokers in our community. This has led many to either relapse or drastically increase the amount that they were smoking before the pandemic hit. We're having a good amount of callers now informing us that they've slipped and started smoking again and they need our help to get back on track. They express how grateful they are that they have our program to turn to. The fact that they're seeking our services reflects how badly our services are actually needed. And if we're not there, who they're going to turn to? They need our encouragement and support in guiding them through a very difficult time in their lives. We've also learned that over the past year that COVID-19 primarily attacks the lungs and makes tobacco use especially concerning.
Please conclude your remarks.
I'd like to thank you very much for allowing me to testify. Thank you.
Thank you very much. Next, we have Blue Zones Project in opposition.
Thank you, Chair Kim Kekohole, members of the Education Committee and members of the Health Committee. Kobe Takeda representing Blue Zones Project, and thank you for this opportunity to testify in strong opposition to this bill. Blue Zones Project was brought to Hawaii by HMSA to help increase the overall well-being of our communities, and investments in tobacco prevention and cessation programs, as well as the policy changes that you all helped to make, are some of the key ways we can improve population health, reduce inequities, and lower economic impacts associated with the many health problems associated with these costs. For some background, Blue Zones Project has been working with communities across the state for many years and are actually in many of the communities that you represent. We work with community members to make substantial programmatic and policy changes to improve well-being at work sites, restaurants, schools, and community members that join us for our events, as well as with our small group gatherings, enjoy our parks, drive on our streets, and utilize community amenities. Our comprehensive approach of transforming community well-being also allows us to work with thousands of parents and youth groups, community organizations, faith leaders at churches, and health professionals. Over the past 3 years alone, we've worked with over 100 schools, both public and private, making the commitment to tobacco prevention and education. Principals and teachers often comment that they see tobacco in their schools, so through vaping, through their students as low as 6th grade. This bill jeopardizes decades of progress in tobacco prevention and control efforts at a time that it's needed the most. The trust fund supports essential community-based prevention and programs, especially those who are from the LGBTQIA communities and individuals of low socioeconomic statuses. Those who will be most affected are often also struggling with other social determinants of health, including unemployment, poor access to healthy food and healthcare services, homelessness, and lack of limited social networks. For the health and safety of our families, we respectfully request that these committees oppose this bill. Thank you for this opportunity to testify in strong opposition to this bill.
Thank you very much. Hawaii Community Foundation in opposition.
Hello, Chair Kalole and Chair Kim, members of the committees. Thank you for the opportunity to testify in opposition of this measure. I'll stand on my testimony, but I would like to just make a couple points. The fund has really been an anchor in the community for the state to coordinate its anti-smoking activities around. And over the last 20 years, it's really been an anchor to get other funds to coordinate around it. It's been very effective. I think Pedro from the American Lung Association articulated the oversight that exists around the fund and would be very, would make ourselves available off session to work with the legislature on that oversight and inform them of the value of the fund. I also want to make note that our lead staff, Tom Matsuda, is on the call here today for more specific questions around this measure. I would be happy to answer any of those questions. Mahalo.
Thank you. Next, we have Mr. Matsuda in opposition.
I'll defer to the comments from Micah Kane, and I'll be available for questions. Thank you.
Thank you very much. Next, the Hawaii COPD Coalition in opposition.
This is Valerie Chang with the Hawaii COPD Coalition. Thank you so much for allowing me to testify. Our organization did receive a grant from this, the trust fund from 2008 through 2007 to 2012, and we were able to test over 1,200 people a year to let them know how well or poorly their lungs were working. And we thought that was very valuable to help educate them on the connection between how well they breathe and how well they will breathe in the future based on their exposure to smoke and other irritants. And I think it's crucial that we continue the good programs that the Hawaii Community Foundation has been able to help shepherd us through. I mean, they help with the RFP, they help with the process to make sure that all the organizations that are being considered are properly vetted. They make sure that the funds are properly distributed in a timely manner. They help with the evaluation. They are doing all the things that are needed to make sure that there is credibility behind everything, every dollar that is spent with the Hawaii Community Foundation. And as was said, they're happy to work with the legislature to make sure that the legislature is confident about all of this. Anyway, thank you very much, and all my other points are in my testimony.
Thank you very much. Next is Hawaii Health and Harm Reduction Center in opposition.
Chair Baker and members, my name is Nico Sleverins with the Hawaii Health and Harm Reduction Center. We administer the statewide syringe access program. We also provide medical case management services to 700 people living with HIV on Oahu. And we also work with other people impacted by social determinants of health, including persons experiencing homelessness and housing instability. And we are a grantee of HCF and the trust fund, and we have a number of certified tobacco treatment specialists on hand who specifically work with sexual and gender minorities, people living with HIV, and our homeless population even. And we've managed to integrate tobacco cessation across our programs, and we oppose the dissolution of the trust fund. Thank you very much.
Thank you very much. Next, the Hawaii Public Health Institute in opposition.
Thank you, chairs, vice chairs, members of the committee. Jessica Yamauchi, on behalf of the Coalition for Tobacco-Free Hawaii, a program of the Hawaii Public Health Institute. We are strongly opposed to House Bill 1296, which repeals the Tobacco Prevention and Control Trust Fund. We recognize the budget deficit the state is facing and appreciate the appropriation, but this bill would lead to a reduction and gap in services, undoing decades of progress. Dedicated, consistent funding is critical to developing robust tobacco prevention and education efforts, and the recent rise in e-cigarette use among youth has highlighted the ongoing need for these programs as the industry finds new ways to hook our keiki onto nicotine. We did want to note that the trust fund can only be used for tobacco prevention and control, and this has translated to prevention and cessation services across all 6 major islands, prioritizing programs that serve populations most burdened by tobacco. The trust fund's primary source of funding is 12.5% of Hawaii's annual MSA payment, as well as interest and dividends earned through investing the funds. And in this current structure, it's self-sustaining and does not take any taxpayer dollars. Using MSA funds for the trust fund is also aligned with the settlement's intent to help states recoup the cost of treating tobacco-related illnesses. Over the last 20 years, tobacco prevention and control has saved the state over $1 billion in healthcare costs. And beyond cost savings, these programs save lives. The public recognizes the trust fund's importance, and 97% of registered voters in Hawaii support having a portion of the MSA payments dedicated to preventing kids from smoking and using e-cigarettes and helping adults to quit smoking. Losing the trust fund and the programs it supports would increase the burden of tobacco in our communities and be a victory for the tobacco industry. We strongly oppose this bill and respectfully ask you to hold this measure. Thank you.
Thank you very much. Next, the Hawaii Smokers Alliance in support.
Hi, Chair, they're not present.
Thank you. Kapi'olani Smoke-Free Families in opposition.
Aloha. My name is Dr. Brian Mee. I'm a pediatrician and medical director for Kapi'olani Smoke-Free Families, and we are a grantee. And for the past decade or so, we've been providing services at Kapi'olani Hospital, but also recently we've expanded services throughout Hawaii Pacific Health. And I do stand on my written testimony, but want to highlight kind of the one-on-one picture that we see in the hospital, because we provide services for those who want to quit tobacco or nicotine. So each day that we are there, we're accessible to people who are ready to quit. And sometimes that's a little window. It's similar to this 2-minute window that each of us have here to testify. And so when they have that readiness to change, we want to be available for them. The picture is, children who are in the hospital for a respiratory illness, or pregnant women who are at risk for delivering early because of smoking and nicotine exposure, or the rise of adolescent nicotine use as well. Usually that's increased when parents or other family members are smokers or nicotine users. So as we have seen, each dollar that we invest in tobacco prevention and cessation results in about $6 or more of savings in direct healthcare costs. On a daily basis, that means not seeing a premature baby born sooner with the intubation, with the IV lines running in, or seeing your child in the hospital getting respiratory treatment. And so we want to be available for them, and we support the important work that the foundation and the trust fund provides for us. Thank you very much for allowing me to testify in strong opposition to HB 1296.
Thank you very much. Next, we have Tobacco Free Kids Action Fund in opposition.
Good afternoon, Chair and members. Lindsay Freitas with the Campaign for Tobacco-Free Kids. I'm testifying today in strong opposition to HB 1296 HD1. Hawaii has long been a leader among states in reducing tobacco use and improving health, and a key to that success has been the dedicated and protected funding that is available through the trust fund. Studies clearly show that funding these programs is a critical component in fighting tobacco-related disease and mitigating the costs associated with it. Smoking costs the state's Medicaid program $141.7 million and leads to a loss of $387.3 million in lost productivity and wages. Funding programs that focus on tobacco prevention and education are proven to lower smoking rates and mitigate the financial impacts smoking has on a state. Data from numerous states that have implemented programs consistent with CDC guidelines show significant reductions in youth and adult smoking. The most powerful evidence, however, comes from the national studies that look across states and control for as many of the relevant confounding factors as possible. These rigorous studies consistently show the effects that tobacco prevention and cessation programs have and the importance of funding them in a dedicated and secure way. Hawaii is in the midst of a youth e-cigarette crisis, and we need this dedicated funding now more than ever. Thank you for the opportunity to provide testimony.
Thank you very much. Next we have individual testimony in support from Anthony Orozco.
Hi, Chair, they're not present.
Thank you. Robert Weiner.
Yes, I'm opposed to this bill. My wife and I practiced medicine on Kauai since 1976. While I was still in training, my father died of tobacco-related illness. We've certainly seen a lot of youth and older people die of tobacco-related illness since we've been practicing here on Kauai. I think there'll be a lot of litigation if this money goes into the general fund. We don't even know the ramifications of vaping at this point. It took many decades to determine cigarette smoking's danger, and vaping produces a lot of chemicals, the long-term use of which we have no idea about. So we're strongly opposed to this bill. We think it should stay in the intended areas where it was stipulated by the settlement agreement. Thank you very much.
Thank you. Helen Barrow in opposition.
Thank you, Chair. My name is Helen Barrow, and I'm testifying today as a private citizen in strong opposition to HB 1296 that would repeal the Hawaii State Tobacco Prevention and Control Trust Fund. The funding for these programs is paid into the master settlement agreement by tobacco companies and was designed to be held in perpetuity. To take away the Tobacco Prevention and Control Trust Fund would be a big step backwards for Hawaii, and that is why I oppose HB 1296. Since the 2000s, Hawaii has saved over $1 billion in healthcare costs by implementing tobacco prevention and cessation. Looking at the big picture, money and most of all, many lives have been saved. Right now, we have a healthcare crisis on our hands, with 1 in 3 high school students and 1 in 5 middle school students reporting that they are currently vaping. So how many lives will you save today by keeping the Hawaii State Tobacco Prevention and Control Trust Fund? How many lives will you save today by helping kids say no to tobacco and vaping, and to help adults quit tobacco and vaping? Thank you for this opportunity to submit testimony.
Thank you very much. Clifford Chang in opposition.
Senators Keohokalole and Baker and members of the Committee on Health, Senators Kim and Kidani and members of the Committee on Higher Education. Thank you very, very much for this opportunity to testify. I am Clifford Chang, testifying as a private individual involved in public health for over 40 years and directly, either professionally or on a voluntary basis, in tobacco use and prevention tobacco use prevention and cessation for over 15 years. I'm testifying in strong opposition to this bill and respectfully ask the Committee on Health and Committee on Higher Education to vote no on this bill and not pass it out of committee. I stand on my written testimony that outlines many of the reasons articulated by many others who are testifying in opposition to the bill, as why basically in my mind this is simply a bad bill. In my written testimony, my points are summarized on page 2, but I would like to highlight a few things here during this opportunity to testify orally. One, as a public health professional, nobody knows better than us what the impact of COVID-19 pandemic is. Believe me, I worked as a contact tracer for a little bit of time, and I fully understand the impact it has had on the state and on the budget shortfall. But I think eliminating the Tobacco Prevention and Control Trust Fund is simply the wrong thing to do. Up till now, Hawaii and the Hawaii State Legislature has been a leader in tobacco prevention and cessation across the U.S. I was involved and the legislator was involved. We were the first state in the nation to pass a $1 tax on cigarettes that helps to reduce tobacco use, particularly among young people who are most price sensitive. We are among the first states to pass a smoke-free workplace law that covers all places of employment, including restaurants, bars, and nightclubs. Kudos to the state legislator for that. We are one of the minority of states that have designated at least a portion of the tobacco master settlement throughout the state in perpetuity. And as a result, we've been one of the most successful states in reducing tobacco use. I urge the legacy of this current 2021 legislative session not be the dismantling of this important fund. Thank you for this opportunity to testify.
Thank you very much. Julian Lipsher, in opposition.
Good afternoon, chairs, vice chairs, members. I'm Julian Lipsher. I'm a member of the Coalition for Tobacco-Free Hawaii, testifying as a private citizen. I'm testifying in opposition to the bill. You have my written testimony. In the interest of time, I'd just like to highlight a few points. The passage of this measure would result in a series of negative health, economic, legal, and policy consequences and be viewed as a victory for the tobacco industry. Is this the legacy that we now see? According to the CDC, smoking and tobacco use remains the single greatest cause of preventable morbidity and mortality in Hawaii and the nation. Dissolving the trust fund and taking the money would reverse 2 decades of progress in battling the tobacco industry. Under a contract with and oversight from the Department of Health, including an advisory board, the fund provides support to grantees across the state that strictly adhere to CDC's evidence-based best practices. Providing an appropriation to the DOH for tobacco control would not come close to matching the highly effective infrastructure that HCF provides. The DOH does not have the staffing necessary or the ability to match the quality of services to seamlessly pick up where HCF would leave off and carry on the levels of grant making, meticulous evaluation, and most certainly investment the foundation provides. Community grant making, programming, and services would be curtailed. Smoking rates, vaping, and tobacco use, particularly among disparate populations, would be expected to rise. Viewed from a public health lens, the success of the trust over the past 20 years can be seen from the significant reduction in smoking rates among both adults and youth, some of the lowest in the nation. Should this be the cause for the taking? The reductions have prevented youth from becoming long-term smokers, assisted adults addicted to nicotine to quit, and saved countless lives with hundreds of billions of public dollars in healthcare. The trust fund has done what it is intended to do: faithfully administer the portions of the settlement. Big tobacco has not left us, and I urge you to consider the good that the trust fund has accomplished for public health in Hawaii. Thank you for the opportunity to testify.
Thank you very much. Bob Toyofuku, in opposition.
Thank you, Mr. Chairman and Madam Chair. I'm testifying as an individual in opposition and not for any of my anti-tobacco clients. I wanted to focus on some of the facts that are important for the committee to consider before voting on this measure. One, the trust fund is funded by the annual tobacco industry payments and not taxpayer revenue, and this has been brought up before. Second, the law provides for oversight over the trust fund by the Department of Health and the Department of Budget and Finance. Also, the Tobacco Prevention and Control Advisory Board, by law, in coordination with the Department of Health, decides on the strategy and the budget for the tobacco prevention programs and communicates this to the entity, which is the Hawaii Community Foundation. The HCF is chosen by the Department of Health with the governor and enters into a contract with the DOH to manage and control the tobacco trust fund programs. And they also invest the principal in order to provide the needed funds for future programs by earning interest. Lastly, I have some concerns as to whether or not the Department of Health has the current structure to manage the tobacco prevention programs as efficiently as the current system. This is not a criticism against the department's staff by any means, but I feel there needs to be an assessment of what the department can or cannot do to manage these programs. So I respectfully, in conclusion, suggest that the legislature may need to assess the situation during the interim, get all the facts and details from the Department of Health and the Hawaii Community Foundation, and if necessary, make any needed changes for next session. Thank you, Mr. Chairman.
Thank you very much. Catherine Akioka in opposition.
Yes, I'm Catherine Akioka. I'm from the Big Island of Hawaii, and I have actually been doing tobacco cessation work for almost 45 years. Until the Tobacco Trust Fund came along, there were no funds in order for anyone to be able to access to help people quit smoking. Because of that, my work now at the Hamakua Kohala Health Center as a tobacco treatment specialist has allowed me to work with over 500 of our North Hawaii and Hamakua residents to quit their smoking, which leads to better health outcomes. The other thing we need to realize, it's not just tobacco, it's actually nicotine and nicotine addiction. And so would you consider taking money away from our opiate programs, from our addiction programs? Nicotine addiction is recognized as a substance abuse addiction and should be treated the same way. We have been able to, at our health center, help many people overcome their nicotine addiction, and by taking away the Hawaii Tobacco Trust Fund, we put at risk those people who could benefit from this program. So I strongly oppose and ask for your consideration to defer this bill. Mahalo.
Thank you very much. That's all the submitted testimony we've received from individuals who indicated they would be present on the conference. Is there anyone else present on the conference who would like to testify? Okay, seeing none, I'd like to note for the record the written comments from the John A. Burns School of Medicine and opposition testimony from the Big Island Substance Abuse Council, the Hawaii Primary Care Association, Hawaii Friends of Civil Rights, the Hawaii Substance Abuse Coalition, Kapi'olani Medical Center, Kokua Kalihi Valley, Lanai Community Health Center, the UH Student Health Advisory Council, Waianae Coast Comprehensive Health Center, Waimanalo Health Center, and We Are One Incorporated. We also have 5 individuals who submitted testimony in support of this measure, and 35 individuals who submitted testimony on an individual basis in opposition. Members, are there any questions? Oh, I'm sorry, I also missed opposition late testimony from the Hawaii Medical Association and the Hawaii Public Health Association. If members have no questions, I have a question for the Attorney General. Thank you, Mr. Goto. There were several comments in the testimony and in the Department of Health testimony that contend that the repeal of 328L5 would break the nexus between the Master Settlement Agreement and the state. But I didn't see anywhere in the testimony and any comments from your office as to whether this measure would void the Master Settlement Agreement. Can you speak to that, please?
Chair, I'm going to have to get back to you on that. The substance of my testimony was directed to the institutional problem with the comparing the contract between the Department of Health and the HCA. I will need to consult with others in our office as to effects of the Master Settlement Agreement.
Okay, thank you. That's the only question I had. Members, questions?
I have a quick question for Hawaii Community Foundation, I guess Micah.
I'm afraid Micah had to leave, but I might be able to answer the question.
Okay, according to his testimony, right now there is approximately $59.9 million in the assets net trust fund?
Yes, that's correct.
And there are some encumbrances, so unencumbered, $41.28 million, plus you receive about $4.7 million to the fund each year. Is that correct?
Well, the 4.76 million was the allocation last year. It goes up and down depending on how much the state receives from the master settlement agreement.
And how much do you actually give out for your programs, your cessation programs and your prevention programs?
Currently, the total amount is close to $7 million a year. Over the 20 years, of course, the amount has gone up and down depending on the availability of funds, but currently it's about $7 million.
So at any given time, you have approximately $40 million in your fund.
So the net balance, unencumbered balance of the trust fund assets has gone up and down over 20 years. The range is between 43 to about 59 million, and the average over that time is about 49 million.
Okay. And then do you guys do a report with who you grant these monies to and what's the return on investment?
Yes.
And is this public? Because we looked for it, we couldn't find it anywhere on the website, anywhere on the internet. And the last report that we have, or I have, is dated December 2009, and I haven't gotten anything since, and I couldn't find anything else on this.
So our requirement under the contract with the Department of Health is to provide quarterly reports on the investment performance to the department. And then we also provide regular reports on the grants and the vendor contracts to the Department of Health. We do not currently have a requirement to provide any reports to the legislature, but we do regularly provide information to the Tobacco Prevention and Control Advisory Board that was created by 328L-6.
Okay, and does these reports that you sent in to the Department of Health, does that include what are the return on investments?
Yes.
Yes? Okay. So quick question, Department of Health, are you still here? Do you have these reports?
Yes.
You folks have these
reports? Yes, we have the reports, and the reports are programmatic in nature. So what we've done is, say for example, the Hawaii Tobacco Quit Line and the cessation grant programs, we can provide you with the return on investment from that program.
Okay.
We have very detailed, specific reports.
Okay. It'd be helpful to also see which entities are receiving the funds and how much are they getting each year. So hopefully we'll get that from you at some point in time. Thank you.
Yes, we can provide that. Thank you, Chair.
Thank you.
Okay, Lola, I have one more question.
Yes, sir.
Your testimony does not seem to contemplate the general fund appropriation in the bill, and I'm wondering, are you assuming that you can't facilitate the programs, or is the position that the appropriation is too low?
I would say it would be both. We do not have the infrastructure to really replicate and to continue the progress that's being made. The Department of Health does not have the infrastructure to manage 16 cessation grantees and 13 prevention programs, and also then to conduct an RFP soon enough for the Hawaii Tobacco Quit Line vendor. Those are all competitively let out and then managed, and there's training that goes with all of the tobacco cessation grantees, some of whom testified today. They've all gone through certification training. That is not something the department has the infrastructure to provide. We have one general funded tobacco prevention program position in the Department of Health. We've had many positions cut, and it would be a departmental lift in terms of the number of contracts that we would have to procure for and manage.
Okay, thank you.
Thank you.
Any other questions? Okay, seeing none, we're going to move to the last item on the agenda, HB 1297 HD2. This measure is relating to state finances, requires each department to submit program managers, cost elements, and accounting reports for all non-general funds to the legislature. It specifies that cigarette tax revenues deposited to the credit of the Cancer Research Special Fund shall only be used for capital expenditures and only until July 1st, 2041. It makes certain special funds subject to deductions for central service expenses into the general fund. And beginning July 1st of this year, transfer the credit of the general fund surcharges and cigarette tax revenue allocated to the trauma systems settlement fund. It also includes an additional part that requires the Cancer Research Center of Hawaii to be affiliated with the John A. Burns School of Medicine with direct lines of reporting to the provost of the University of Hawaii at Manoa and the dean of the John A. Burns School of Medicine. The first testifier we have is the Department of Budget and Finance offering comments.
Chair Kiro Kaloye and Chair Kim, I'm Craig Hirai, Director of Finance. You have our written testimony with comments, and we stand on our written testimony and are available to answer questions. Thank you.
Thank you very much. Next, we have the Department of Education offering comments.
Hi, good afternoon, Chair Keho Kolele, Chair Mercado Kim, and committee members. Brian Hallett on behalf of Superintendent Kishimoto. The department stands on its testimony with comments. I just wanted to highlight some of those comments. As the exemptions to the central service and admin overhead charges they're being maintained for the DOE's 5 active funds, our comments are really directed towards Section 1, the new reporting requirement added in the HD2. The department supports transparency and reporting with the current format required by Chapter 3747. This new report asks for a lot of new information. It's duplicative of what's already required in other areas in current budget reports and variance reports. It adds requirements that are not easily understood, things like program size, indicators. It asks for a report on cost elements to include but not be limited to the following. And what follows, it's really not easily understood what's actually being sought. So I just wanted to share that when the 3747 annual report format was created, it took several years of work and engagement between legislative staff and the executive branch to develop that format. And I would suggest that perhaps that type of iterative, collaborative process is warranted here to ensure that the legislature is getting the information it needs to inform decisions. It will take a lot of work to prepare this, and again, it may actually create confusion because it's seeking this information to be submitted by October 1st, which is before the budget development process has even completed. So there'll be likely a misalignment and potential for confusion about what folks are looking at in these non-general reports, which will not align with the budget request that's going to be submitted by the governor 30 days prior to the session. I just wanted to share that specifically in relation to Section 1. Thank you for the opportunity to provide comments.
Thank you very much. Next, we have DHS offering comments.
Chairs, Vice Chairs, members of the committee, Kathy Betts, Director for the Department of Human Services, will stand on our written testimony providing comments, also respectfully requesting consideration of extending the reporting deadlines that are proposed in this measure. Thank you.
Thank you very much. Department of Taxation offering comments.
Aloha Chairs, Vice Chairs, member of the Joint Committee, Titan Sakata, on behalf of Director Choi, we stand on our written testimony providing comments available for question. Thank you.
Thank you very much. Next, we have the University of Hawaii in opposition.
Oops, sorry.
Go ahead, Provost.
Please go ahead.
Aloha Chairs, Vice Chairs, and members of the committee. I'm Michael Bruno, Provost of the University of Hawaii at Manoa, and along with David Lassner, President of the University of Hawaii, we respectfully stand on our written testimony in strong opposition to Part 3 of HB 1297 HD2 proposed SD1. I would like to emphasize one point, however. We fully realize that our work to expand synergies across the Kaka'ako campus is not yet complete. However, our ongoing efforts to achieve efficiencies in the areas of research, education, clinical practice, and administration within Kaka'ako and with other health sciences programs on the Manoa campus do not require the imposition of a specific structural change that would then require further legislation in the future if we are to continue to evolve. And I'm happy to answer any questions. Thank you.
Thank you very much. We also have testimony in opposition from Calvert Young.
Thank you, chairs. Actually, my testimony is actually related specifically to Part 1 and 2 of the underlying bill and the draft of the proposed draft of the Senate. Actually, the current version in both of those bills for Parts 1 and 2 reflect, as far as the university is concerned and impact, reflect measures or components that could be agreeable to the university. So we're only offering comments. It is on Part 3 that we are opposed, and you can reference Provost Bruno's testimony. Thank you, chairs.
Thank you very much. American Cancer Society, Cancer Action Network in opposition.
Thank you, chairs, vice chairs, and joint committee members. Cynthia Al testifying on behalf of American Cancer Society Cancer Action Network. Respectfully, we stand in opposition to Section 3 of the bill. Cancer is the second leading cause of death in Hawaii, with 2,500 deaths each year. If we are serious about fighting death and disease, please reconsider limiting the use of Hawaii's Cancer Research Fund, which may impair the ability of the UH Cancer Center to function and jeopardizes the operations of the Cancer Center to do life-saving research of medical treatments to improve the quality of life for cancer patients and survivors. Thank you for the opportunity to testify.
Thank you very much. Hawaii Tourism Authority in opposition.
Chairs Gail Hokalole and Mercado Kim, Vice Chairs Baker and Kidani, and all committee members, and John DeFries, President and CEO of HTA. We stand by our testimony in opposition, and we'll stand by for any questions that may arise. Thank you.
Thank you very much. Next, we have the Hawaii Pacific Health offering comments.
Good afternoon, Chair. Mike Robinson, Hawaii Pacific Health. We stand at our written testimony offering comments, and our comments are limited to the portions of the bill affecting the trauma special fund. Thank you.
Thank you very much. Joe Ramos in opposition.
Aloha, chairs, vice chairs, and members of the committees. I'm Joe Ramos, and I'm testifying as an individual in strong opposition to the proposed SD1 Part 3. I'm speaking in opposition to SD1 only. I've been a professor at the Cancer Center for 17 years, and in my roles over the years as the Cancer Biology Program Leader, Associate Director of Administration, and currently as Deputy Director, I've written large sections of our last 2 NCI designation renewals. I also sit on the site visit teams to review cancer centers in other states for their NCI designation. I therefore know a great deal about the requirements for the designation. My foremost concern is the language added in SD1 will greatly endanger the renewal of this designation for us by affecting the authority of the director specifically. This is one of the most significant review criteria of the NCI renewal process, and it's a key differentiator that helps us rise above our competitors. I also want to first thank you guys for all the support the legislature has provided the Cancer Center over the years. Your support continues to be a very important reason that we've been able to renew the designation since obtaining it in 1996. For example, the NCI review at our last renewal noted the following about your commitment. Quote, institutional commitment is rated outstanding. The University of Hawaii and the state are fully committed to ensuring the success of the UHCC as the only cancer education and clinical research center. Related to SD1, the director currently has authority over administration, finances, hiring, tenure decisions, and space allocation within the Cancer Center. This was essential to our renewal. I quote again from the NCI review. Quote, the center director is rated outstanding. Dr. Holcomb has complete authority over all resources at the center, which includes space, faculty recruitment, and appointment of members, and all Cancer Center revenue and financial matters. His direct control and authority over the cancer programs and shared resources, as well as clinical trials and infrastructure, ensures that the center remains mission-focused. Finally, as noted by NCI and other testimony from our faculty, center culture and finances have improved significantly in the last 5 years. Thank you for this opportunity to testify in strong opposition to SD1, Part 3.
Thank you very much. Cliff Martin in opposition.
Thank you, Chair, Vice Chairs, and members of the committee. I'm Cliff Martin. I'm Associate Director for Administration at the University of Hawaii Cancer Center. I've written testimony, and I stand on that, and I'd be happy to answer any questions you have. Thank you.
Thank you very much. Unhee Lim in opposition.
Hi, Chair, they're not present.
Okay, thank you. That's all the testimony we've received from individuals who indicated they would be present on this conference. Is there anyone else who would like to testify on this measure?
I'm here. I don't know why the host did not recognize me.
Okay, are you able to activate your video?
I cannot. I don't know why. Can I just testify still?
Okay, please.
Okay, I'm sorry about that. My name is Unhee Lim. I'm an associate professor at the Cancer Center. I submitted a written testimony in strong opposition. Okay, start my video. Host has allowed me. Okay, so I submitted my written testimony in strong opposition on behalf of 54 individuals, but this oral testimony is my own. I just want to share with you our reflection in this process. One point is that we have developed, many of us have developed serious doubts about this testimony process, because this is 5th or 6th testimonies we have submitted, and we would have thought that if you paid attention, you would have by now corrected the false information, false assumptions, rash assumptions in the bill, but that has not happened. You would have engaged us before making decisions that can be most likely devastating and leading to the loss of NCI designation. So that has been very, very disappointing. My second point is, considering the impact of losing NCI designation for the people of Hawaii, we should not second guess what is enough or not enough for NCI designation. NCI sets that rule, and one entire evaluation criterion out of 6 all about cancer center director. And it's that important. And one criteria authorities, or the sole authority, independent authority of the director for the management, finance, space, and personnel management, that is a precious criterion we have been able to score well over when we were against stiff competition with the giant cancer centers with limited resources. And this bill will take that away. In terms of director performance, Randy Holcomb has aced it. And you can read the review that they rated he had a transformative impact on the cancer center. I could not have described it better, and he continues to do so. Please reward the excellent performance of our administration, our cancer center members, and collaborating community and clinical members by protecting the NCI designation and our administrative structure. Thank you.
Thank you very much. Is there anyone else on the conference who would like to testify? Okay, seeing none, I'd like to note the written submitted testimony in opposition of the University of Hawaii Professional Assembly, the Hawaii Substance Abuse Coalition, Ho'olalahui Hawai'i, Wilcox Medical Center, supporting testimony, late testimony from the Department of Public Safety, comments from the Department of Transportation, opposition testimony from Alana Dung Research Foundation, Friends of the UH Cancer Center, and the Queen's Health Systems. We also have 10 individuals who submitted written testimony in opposition. Members, any questions? Okay, seeing none, let's recess for decision making.
Hi, Chair, we will now enter the breakout.
Okay, we're going to reconvene the 3:15 p.m. joint committee hearing between the Health and Higher Education Committees. Because we are running out of time, we're going to defer decision making on these two matters to tomorrow, Wednesday, March 24th at 1:30 p.m. In order to allow the Higher Education Committee to vote out their agenda today. On that note, we are adjourned.
Thank you. The Higher Education Committee, we are in decision making. So we're going back to our 3 p.m. agenda. Members, starting with House Bill 313, relating to physician workforce assessment. The recommendation is to pass with amendments. adopt UH's amendment to change the name of the program from Hawaii Rural Healthcare Provider Loan Repayment Program to Hawaii State Loan Repayment Program. Any discussion? Hearing none, chair votes aye.
House Bill 313 passed with amendments. Chair votes aye. Vice Chair votes aye. Senator Agaran?
Aye.
Senator Wakai?
Yes.
Senator Favela? Senator Favela?
Aye.
Mahalo. Measures adopted.
Thank you. House Bill 389, draft 1, relating to post-secondary education. This is the one where institutions for profit has to put and disclose. I'm going to recommend that the disclosures are made on the institution's official website and on the contracts and any promotional media going forward, so they don't have to change any of, and not on their catalogs and so forth, because I think that was one of the issues that was raised about costs, and there'd be some technical and non-substantive amendments. Any discussion on this? Hearing none, chair votes aye.
With all five members present, are there any reservations? Any objections? Hearing none, measures adopted.
Okay, thank you. House Bill 1291, relating to scholarships. Recommend that we pass with amendments on page 2, line 17. Instead of 2 years, we're going to change that to 3 years. And on line 18, change it from kindergarten to grade 7 to 12 instead of kindergarten to 12. And the recommendation from UH was 9 to 12, but I think 7th grade, I think, is a good time frame. And then also delete section 2 referencing the Promise program, because as noted, Promise program is a need-based program. Any discussion, members? Hearing none, chair votes aye.
With 5 members present, are there any reservations? Are there any objections? If not, measures adopted.
Okay, on House Bill 1067, House Draft 1, relating to procurement for the University of Hawaii, I want to recommend we pass with amendments, tech non-substantive amendments, and extend the sunset date to June 30, 2024. Any discussion? Not, chair votes aye.
With 5 members present, are there any reservations? Any objections? Hearing none, measures adopted.
And on House Bill 1069, House Draft 1, I'm going to recommend that we pass unamended, but the intention is to incorporate this into the bill that we heard with the Cancer Center to put it all in one. We'll go ahead and pass this out. We can always have the next committee hold this measure if it does get inserted. So the recommendation is to pass unamended. Chair, any discussion? If not, chair votes aye.
With 5 members present, are there any reservations? Are there any objections? Hearing none, measures adopted.
Okay, and that's all we have, members. We'll see you tomorrow at 1:30 for decision-making on those 2 measures that we had. Thank you. We are adjourned.